I also want to turn to a situation that has developed or has at least received more scrutiny over the past 24 hours, and that is the situation about long-term care in Ontario. The Premier of this province says that more funding is the key to solving this province's long-term care problems. His comments come just days after his government publicly released a report detailing the horrific state of 5 homes in the province, 4 of which his government has now taken over management of.
We need funding. We can't do it alone. No province can do it alone. We need their support. If we want to change the system, a broken system that's been around for decades, we need money. That's what it comes down to. And if we get the funds, then we can make some massive changes. But we need the money off them.
So will money make the difference? I want to bring in now Jerry Dias. He's the president of Unifor, which represents 15,000 long-term care workers in Ontario and more across the country. He joins us from Toronto. Hi, Jerry. Good to see you.
Always good to see you, too.
I appreciate you making the time. Look, I wanted to get your perspective, what you were hearing from your members, because I know you sent a letter to the Premier back in December, if I'm not wrong, highlighting some of the issues we're hearing about today. What do you think about the scope of the problem? What have you heard from your members?
Well, our members are concerned. They're nervous. They're going to work every day. They still lack the personal protective equipment they need in order to feel safe. They're dealing with deaths in the long-term care facilities. But I think the frustrating part for them is we've been talking about this for years, and nobody's done a thing. And a lot of this started, Vasi, back in 1995 when Mike Harris was the Premier and he deregulated the industry. He really moved from a public long-term care facilities, a publicly owned system, to make it a lot easier for profit. And take a look at the results today. I mean, because everybody argues, look, the government can't do anything, give it to the private sector. Well, guess what? It hasn't worked very well for us. Because we know today that 75% of the deaths, 75% of the problems in long-term care facilities are for profit. And that's what happens when it's profit before people. That's what happens when the care of our parents and our grandparents are turned over for those that are determined to profit off of them. And that's the tragedy of this entire situation.
You're right that it's disproportionately affecting homes that are privately run, but it's not solely affecting homes that are privately run, right? There are still public homes that have seen a high number of deaths too, and a lot of criticism about the way in which the outbreaks have been handled there. Is there something beyond, and I take your point on the privately run ones and whether or not that should change, and certainly we've heard the point made politically as well, but is there anything beyond that you're hearing from your members you would like to see from the government?
No, look, we've been talking about it for years. They're short shifting all the time. In other words, there's never enough workers to provide the proper care. If everyone is at work in a long-term care facilities, there's usually one PSW for 12 to 14 residents. At night, it's about 1 for 30 and 1 for 40, depending on afternoon or midnight shift. So the question is regulations. The question is hours per resident. We've been advocating for years that there should be 4 hours of care per day per resident. That means that regardless of your profit or not for profit, you would have to hire enough people to make sure that you're living up to the commitment to the residents. But nobody's doing it. Everybody always bought into the, don't worry about it. It has to be for profit. It has to be, the residents become secondary. But all it needs is one easy fix. The government needs to step in and say, okay, this tragedy in itself was avoidable. We've all dropped the ball and we're going to fix it. So we had the deregulation in Ontario back in 1995 under Harris, and I would suggest that Doug Ford, based on what he's saying, should be fixing it as a result of the mess that was created back in 1995.
Let me ask you what kind of response you had, first of all, when you sent that letter. And I believe in the letter you also, I read it, and you also asked him to spend a shift with you, basically, and see what people were going through there. What kind of response did you have then, and have you had any interaction with the province, in light of this report from the military?
Well, I sent a letter to Doug back in December saying, look, spend an 8-hour shift with me in the long-term care facilities. Because what is happening has been going on for years, and it was only a matter of time, and we didn't expect it would be like this. And we got no response. And then, of course, I sent a follow-up letter. But The bottom line is it's not just this conservative government. Look, we had 15 years of liberal governments and they did absolutely nothing. Mike Harris's government actually created the problem or made the problem even worse, so nobody's done it. So there's enough blame to go around, but enough about the blame. Who's going to fix it? Because we all know what the problem is. It's about low pay. Look, PSWs have no respect. They get paid very little. In non-union environments, they make basically minimum wage. Because of the deregulation and for profit, they have to work in 2-3 long-term care facilities because they're just given part-time hours, casual hours. That way, the employers don't have to pay benefits. So here's workers that are providing such an essential service for our families and are treated horribly. The pay is terrible. And so they've left. At the time of the pandemic, there were tens of thousands of PSWs that left the industry because it just wasn't worth their while. They couldn't support their families based on working 2-3 jobs. The system is broken and needs to be fixed. We all know that. Let's get at it.
I just have 30 seconds left, but I did want to ask you on the exact subject that you just raised. And I should note that we have asked for a member of the Ontario government to interview about this for the past 3 days, and no one has been made available. But on the subject of topping up pay, we know that the federal government has helped out for at least a 16-week period for topping up the pay of people who work in these homes. Is this something that needs to be extended? Should it be mandated by the provincial government? What do you think?
It needs to be mandated, period. Look, governments can mandate minimum wages. They can mandate minimum wages in sector. It's about time. It's about time that governments recognize the work of our COVID heroes and decided that they should be paid appropriately. Governments can minimize livable wages for those workers that are so essential in today's environment. Our seniors deserve better. Governments in control, they can fix this.
All right. Thanks, Jerry. Really appreciate your time this evening.
Thank you.
Jerry Dias is the president of Unifor. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.